Hello, this is The Nurse as Research Consumer, Chapter 10. The learning objectives for this week are discuss the trend toward evidence based practice in nursing, describe the nurse's role in research, discuss the relevance of political action to nursing, discuss the nurse's collaborative role, describe the competencies in collaborative practice, and analyze factors that affect collaboration in healthcare. Your keywords for this week are evidence-based practice, power, sources of power, collaboration, collaborative practice, and collegiality. Challenges and opportunities include gaps between research and practice, implementing practice changes, providing high-quality care with accountability, and confidence in decisions based on scientific evidence. So first we'll talk about evidence-based practice. Sound knowledge base is necessary for decision making in practice. There are sources of knowledge, and they include traditional sources, which has been passed down by those who came before you. The standard of nursing in the past has been passed on by experienced nurses who have been practicing for years. Their traditional information is conveyed through journal articles, books, observed practice, and role modeling. Tradition can come from any number of sources, most of which would have been established for some time, perhaps with the current generation not even being aware of the genesis of the practice. Many times there is no research to show that this improves safety, but is just something we have always done. So you may hear people say that is the way we've always done it. According to Nishamati, the traditional approach can lead to the development of a nursing culture that accepts practices as being right without questioning the foundation or evidence base. The next way of a source of knowledge is authority. Authority comes from those who have experience and are an authority in the field. For example, there are many nurses that have advanced education or certificates. Authority can be those in manager or higher fields. This can also be doctors, and it also can be other staff. Specialized professions often allow us to obtain information for questions we may not be so sure on. Authority is someone with advanced knowledge on a subject, whether that be pharmacy or respiratory. Trial and error. As nurses, especially new nurses, we have all learned through trial and error at one point in our career. It is a way to improve patient care and discover best practices. Trial and error, unfortunately, may play a role in patient safety. The last source of knowledge is intuition. Intuition is knowledge and experience combined with critical thinking. I think we use intuition more than we realize. Intuition is instinctive knowledge. It is a feeling that something is wrong or about to happen. It makes us pay attention to a situation. When we get this feeling, it provokes us to begin the critical thinking process because we know changes must be made. Intuition often makes us respond in a way to make a situation better. A case for evidence. As the public becomes more computer literate, they have broader access to information regarding healthcare issues and incidences of medical errors within healthcare facilities. Use of evidence-based practice allows nurses to structure how to make accurate, timely, and appropriate clinical decisions. Evidence-based practice is a problem-solving approach to clinical practice that integrates the conscientious use of best evidence in combination with a clinician's expertise and patient preferences and values in making decisions about patient care. Without evidence-based practice, nursing would be a practice solely based on tradition. While in practice, you will need an up-to-date textbook, articles from peer-reviewed nursing journals, and nursing research. Evidence-based nursing practice means that nurses make clinical decisions based on best research evidence, their clinical expertise, the preferences of patients. Evidence-based nursing practice is vital to the delivery of quality care that improves patient outcomes. Research suggests improved patient outcomes when best evidence is used in the delivery of patient care. Despite awareness of the importance of practicing by using best evidence, integration of evidence-based practice into daily clinical practice remains slow and inconsistent. This model for evidence-based clinical decision making shows how using your clinical expertise and considering patients' values and preferences ensures that you will apply the evidence in practice both safely and appropriately. Using a step-by-step approach ensures that you will obtain strong evidence to apply in the patient care setting. There are various databases available for collecting the best evidence. Examples of databases include Medline, CINHL, or Ovid. Critiquing the evidence oftentimes presents the most difficult step in this process. You want to be able to answer the following questions. Do the articles obtained offer evidence to explain the question? Is the evidence reliable and true? Can the evidence be used in practice? All articles should contain the following information, which will help you to read and understand the content. There should be an abstract, an introduction, a literature review or background, a manuscript narrative and purpose of statement, method and design, results or conclusion, and clinical implications. The Agency for Healthcare Research and Quality provides the strategies listed on this table for implementing evidence-based practice. And I've included this table in the text format of this PowerPoint. There is a hierarchy of evidence, and this demonstrates what the hierarchy is. The hierarchy of available evidence offers a guide to the types of literature and information that offer the best scientific evidence. This diagram of the hierarchy of evidence shows that stronger evidence is further up the triangle. For instance, a well-designed random controlled trial, RCT, carries more weight than the opinion of even experts. A randomized controlled trial is the highest level of experimental research. The International Council of Nursing supports nursing priorities for nursing profession to guide research priorities for nursing profession and to guide research efforts of nurse scientists in those healthcare areas with greatest need. Research is a systematic process that asks and answers questions that generate knowledge, which provides a scientific basis for nursing practice. Nursing roles in research include all nurses share a commitment to advancement of nursing science. Nursing research and participation is dependent on the level education of the nurse. Nurses in clinical practice can identify the problems in need of investigation. Nurses need to support the research process. Nurses need to assist with data collection and analysis. And nursing research course is a requirement in baccalaureate level education. The relationship among research, evidence-based practice, and quality improvement is overlapping and reinforcing. The Joint Commission defines quality improvement as an approach to the continuous study and improvement of the processes of providing healthcare services to meet the needs of patients and others. We often look at fall prevention, medication delivery, decreases in hospital-acquired infection, and pressure ulcers as indicators of overall quality of care. In performance improvement, an organization analyzes and evaluates current performance using the results to develop focused improvement actions. Remember that evidence-based practice and quality improvement go hand in hand. Combined, they provide the foundation for patient care and outcomes. When implementing a research project, evidence-based practice, and QI, which can provide opportunities for research. Rapid cycle improvements measured through QI often identify gaps in evidence. Similarly, evidence-based practice literature reviews often identify gaps in scientific evidence. Thus, the two processes help to identify topics for research. An analysis of QI data leads clinicians to understand work processes and the need to change practice. One type of QI program is the PDSA cycle or approach, and it is listed on this slide. So the P is plan. That would be review available data to understand existing practice conditions or problems to identify the need for change. Do, select an intervention on the basis of data reviewed and implement the change. Study, that just means that you need to evaluate the results of the change. And act, if the process change is successful with positive outcomes, then act on these practices by incorporating them into daily unit performance. There are ethical concerns when you are talking about research, so we need to advocate for patients' rights. Participation in studies must be voluntary, and we must safeguard patient rights. Remember that the patient or the participant cannot be harmed. You need to provide a full disclosure. There has to be self-determination, and privacy and confidentiality need to be maintained. There are two major approaches to investigating phenomena, and they are called quantitative research, which is precise measurement for data collection and analyzes numerical data, and qualitative, that is narrative data that describes the phenomena in an in-depth and holistic fashion. Its qualitative is flexible and less controlled. Data collection can be completed according to three categories. You can collect data using biophysiological measures, observation, or self-report by study participants or subjects. To analyze and interpret the data, the conclusions will be supported by this data, so that's really an important feature. Transitional research is the process in which study findings are used to initiate and support innovations in the delivery of nursing care. And it's the dissemination and utilization of nursing research. There are 4 stages before adopting research-based ideas or practice. The 4 stages are knowledge, persuasion, decision, and implementation. There are barriers to evidence-based practice implementation, and they can be either clinician or environmental. There's also facilitating factors for implementation of evidence-based practice. And the facilitating factors are a systematic approach, administrative support is important, newsletters, research meetings, continuing education programs, computer networks, and research study guidelines.